based services to this population. Through this, Virginia was able to partner with the Institute of Innovation and Implementation through the University of Maryland School of Social Work to bring wraparound training to you. In WRAP, a viable practice in our state to build capacity and sustain these efforts, we decided that wraparound had to be woven into our systems of care. With much collaboration over the past year with HDS and CSA, we submitted an application requesting additional funding through SAMHSA for Systems of Care Implementation Grant for a Center of Excellence. A few weeks ago, we learned that the implementation SAMHSA grant was awarded to Virginia and opened the door for Virginia to develop a Center of Excellence, or C, as we refer to it as well, which was operated through our Office of Comprehensive Services. The Center of Excellence will be the hub for all around efforts and training for our state, and we are in the very early stages of this rollout and seeking lots of technical assistance, training from the Institute as we move forward. The Institute will be working with us to build capacity so that Virginia can stay in the wraparound approach. If you have specific questions on wraparound for Virginia, that you can contact me directly. And with that said, I will turn this over to Kimberly and Marlene.
Thanks, Mindy. So this is Marlene Matarese, and I'm the Director of the Training and Technical Assistance Center at the Institute for Innovation and Implementation at the University of Maryland. And I am here with Kimberly Coviello. Kim, do you want to introduce yourself?
Yes, Kim Coviello, and I am a national trainer and coach with the Institute. And I'm going to start off by introducing a little bit regarding the role of the Institute.
Yeah, and Coviello is going to be the trainer for Virginia. So that's why he's on this call. For those of you who are going to be involved with the implementation of wraparound, you're going to be seeing a lot of Kim. So who are we? The Institute for Innovation and Implementation, which I'm just going to call the Institute moving forward, is a national implementation center. We do work in Maryland, and we also do work in about 15 other states nationally. We provide training and technical assistance related to the child and family and youth serving systems. And some of that technical assistance is related to policy, financing, system structures. Some of it's related to research and evaluation, and some on practice model implementation. And for the purpose of this conversation, we're talking about wraparound. Also provide technical assistance around implementation of a variety of different evidence-based practice models. Most of the work we do, we try and do from sort of this model where we're all working together. So within the Institute, we have a center that focuses on policy and financing. We have a center that focuses on research and evaluation. And we have the center that I'm the director of that focuses on training and technical assistance. And we operate from a model of implementation science to where in order to effectively implement any practice model or any innovative practice, you make sure that you have the policies there to support it, that it's financed in a way that's going to support the model, they're evaluating the work that you're doing, and that you have training and coaching associated with the implementation. And that's the work that we're going to be doing with Virginia. We've already set up some conversations to involve Sheila Pyries to really dig in and talk about some of the policy, financing, system structures. We have some research and evaluation that we're going to be doing related to the work we do there to make sure that we are transferring knowledge and that we're doing it in a way that really impacts the workforce. We'll be providing support internally to Virginia to make sure that you guys have an evaluation process set up that's really going to evaluate fidelity to the wraparound model as well as outcomes related to the impact of wraparound as a practice model in your state. So we are to do this work with you, as Mindy talked about, because we have a contract with CMS to provide the training and coaching in wraparound at no cost to states. So we're here for another year and a half. We've been doing this for quite a few years now. We've been doing it as part of the PRTF within Georgia and Mississippi, Indiana, and now Virginia, and also in Maryland. And it's at no cost to the states until this grant runs out, which is, again, in about a year and a half. So we're pretty excited to be able to do this and to be able to offer the resource to states to where it's not a burden to the state at this point. I talked a little bit about, go ahead.
So I'm going to jump in, and I wanted to just say that Marlene has obviously covered a good amount, as has Mindy, for all of the great things that are going on in Virginia at this time. As the national trainer and coach that will be coming into Virginia, I'm really excited about the role that we're going to be able to play in wraparound implementation. So what I want to do now is kind of build off a little bit of what Marlene's already talked about in terms of what our specific role is going to be in support Virginia in these efforts. As Marlene's already mentioned and went more in depth on, we're going to be providing ongoing technical assistance to Virginia. So technical assistance that's going to be available is going to be available and focused again on the wraparound implementation piece, as the research and evaluation of those efforts, policy support, financing, and this will again be done within the specific realm of needs that the state of Virginia has. So we're going to make sure that we fine-tune that to really meet the needs of Virginia. We also going to be involved in certifying a cohort of local trainers and coaches. So we'll be working with the state of Virginia to certify a group of identified coaches and trainers through our Wraparound Practitioner Certificate Program, which we're going to talk a little bit more about later. The purpose of this certificate program is to help provide local coaches with necessary support in the high fidelity and high quality wraparound practice that Virginia is seeking to implement. The program will be designed to support those local coaches through different means such as coaching, training, and technical assistance. And it'll be focused on doing that throughout the different phases of the wraparound process. This certificate program is also going to be put in place to ensure that the capacity and the local expertise is within the state of Virginia and that it's able to remain there once the Institute's training and coaching activities have ended. As Marlene said, we have about a year and a half to get those local coaches and trainers certified so that we can really move that forward and continue efforts in Virginia for the long term. It's also going to be conducted by the Institute in several different core areas of the wraparound process. The training that we provide will be focused on imparting knowledge and understanding of the process, as well as building skills and competencies in specific areas of practice. Those will be available to individuals in various organizational systems and roles. So, for example, we'll be working on training care coordinators, administrators, supervisors, again, the local coaches that we've just mentioned, peer support, and possibly some other folks who will be participating in wraparound implementation. This portion is going to be described a little bit more detail later on in this presentation, where we're going to walk you through some of the specific training modules, as well as the target audience that they will be focused on. So, what is wraparound? To understand wraparound, it's really important to understand how and why wraparound came to be. Wraparound emerged in the early 1980s, and it emerged as a response to overly professionalized and restrictive services for children and adolescents, in particular those young people with high levels of mental health and other related needs. At the time, children and youth with these complex needs were being institutionalized and sent to many times out-of-state residential facilities. In many of the cases, parents were actually being forced to turn their children over to state systems such as child welfare in order to actually access treatment for their kids. So when these children were coming out of the institutions and residential facilities, many of them had been deemed within those programs as successful. For example, they were meeting treatment goals. What became clear was that once these young people were discharged and returned home, many of the problems that led to their residential placements in the first place had continued to exist. What really appeared to be happening as we look back was that youth were learning how to live in these programs. However, they weren't able to apply those same skills in order to live in their homes and communities. An important piece that I think we need to mention to why wraparound emerged is that in addition, research has also found poor outcomes for clinical treatments, and those include evidence-based practices that are in real-world settings. There are reasons for that, and these have been areas where wraparound has emerged to address the needs, and that was that families, first of all, did not feel like the treatments they were getting were relevant to them. They said there was a lack of fit between their needs were and what the actual services and supports were that they were able to receive. Families felt like they were not fully engaged in the process, and this was very apparent. And I think that we still see that in several programs that are out there where families are not engaged in the process or in the services and supports that are provided to them. Programs and systems were also not engineered to support that flexible individual care that many of these families and youth with the complex needs needed. So in response to all of these challenges, Wraparound philosophy emerged and asserted that to be most effective, services should be driven, meaning that families had the primary decision-making role in their own children. Also, that they had a role of being able to inform policies and procedures governing the care of all children. Also, assert that the services needed to be youth-guided. So young people had the right to be empowered, educated, and be involved in decision-making of their own lives. Again, also the policies and procedures that governed all youth. We talked about how wraparound as a philosophy needed to be individualized, meaning that it was focused on that unique family and that services and supports were tailored to meet those unique family needs. Culturally competent, based on the family's strengths, family preferences, beliefs, and values, and finally, based in the community whenever possible. The practice model is by this philosophy, and families to achieve this by serving as a team-based process for implementing services and supports for youth and families with complex needs. This model outlines a defined set of principles, phases, and activities that, when adhered to and implemented in accordance with the model, promote those desired outcomes for youth and families. For this reason, the Wraparound Practice Model and the philosophy that underlies it has really become a core component of systems of care. And although wraparound is usually reserved for what we call our deep-end youth, those at risk of out-of-home placement who are multi-system involved, in other words, those families that tend to occupy that top tier of our system of care, count approximately 5% of the general population. This is the model that has been employed and implemented to work with that population, and it's been done more frequently than many other approaches because of the fact that it really focuses on and it provides that comprehensive community-based care for youth and their families to address those mental health needs as well as those other needs that they have. To take that a little bit further, what wraparound? We've talked a lot about the philosophy behind wraparound. We've talked about wraparounds emerged. But what exactly is this we call wraparound? Well, wraparound is a holistic and ecologically based process that utilizes strengths and assets of the youth and their family, as well as their supports. And that includes, as you can see, both formal supports and informal supports to an individualized plan that meets that family's unique needs and helps them reach their desired outcomes. In fact, the goal of wraparound is to facilitate the creation of a plan that's going to be the best fit for families and youth, and that's going to customize to ensure that those families and youth have what they need, when they need it, how they need it, and that plan will then be managed to ensure that it's truly meeting the needs and that it is resulting in the outcomes that the family hopes to achieve. Let's also be remembered, however, that wraparound is not a program or a service. Wraparound is a process, and this suggests that it is fluid and ever-changing. So therefore, when we develop plans with families, we are constantly revising those plans, and we are looking at the strategies that have been chosen and changing those interventions and approaches as need be to better meet family needs and help them meet their goals for themselves. And I think that this is a pretty important distinction for us to make, because we're talking about putting a person in a program. It really suggests that services have already been determined for them, and this is what many families have experienced in the past. They find that they go into a program, and that once they're in the program, they're only able to receive those services that are specifically offered by the program. This is, for example, of that one-size-fits-all approach or the cookie-cutter approach. And I like a quote by Carl Dennis, who was a forerunner in the wraparound arena. He says, for example, all we have left are extra large and extra small. Take your pick. And that's kind of what the families that we're seeing in wraparound have experienced in the past. They've been told that, we have this program with these services or this program with these services, and that's all that we have available. What Wraparound does is it creates a different approach to working with families and youth, and it's to help them realize their hopes and dreams, and teaches them that they're not only going to be able to access supports to get by here in the interim, but that they're going to be able to get what they need in order to be able to have that support and self-sufficiency and sustain that into the long term. So in fact, it's really changed the way that we're working with young people, families, communities, and our service providers as well. Several things that you'll notice with the wraparound is that wraparound involves truly partnering with families, listening to what youth and families have to say, and incorporating those new perspectives into the planning and the care management processes with the goal of, again, supporting the youth to create and family to create sustained, meaningful change in their lives. So just as with other evidence-based and promising practices, wraparound operates by following a set of values to guide the work that we do with youth and families. In wraparound, we have 10 principles that guide our practice. All the principles are interconnected, and they all build off of one another throughout the phases and activities of the process. In this respect, adherence to the principles and implementation is crucial in order for practice to be considered high fidelity and for us to be doing quality wraparound. What I'm going to do is I'm going to go through each of the principles briefly, just to make sure that we all understand what those principles are and how they are applied throughout the wraparound process. So the first principle, and very importantly, is family voice and choice. And this principle stresses that the family and the youth perspectives are going to be intentionally elicited and prioritized during all of the phases of the wraparound process. So in this respect, the planning process in and of itself is founded in family perspectives of, again, what they need and what strategies are most likely to be successful in helping them to meet those needs and, again, move forward towards a better vision of lives. In this respect, the team will also strive to help provide options to the family that reflect those family values and preferences within the planning process. The next concept or principle is team-based. And one that we need to recognize is that wraparound is a team process. And our team should be composed of people with a strong commitment to the family's well-being. The team consists of individuals committed to them through informal, formal, community support, and service relationships. And we're going to go into that a little bit more as we go through the presentation as well. Another key piece, and one that really truly distinguishes wraparound from several other helping models, is that we recognize the importance of natural supports and how central those supports are to the families and individuals that are participating in wraparound. These are individuals that are in the family's lives naturally. They are individuals that are invested in the family, and they have meaningful, caring relationships with the family. The goal of wraparound is to help the family actively seek out and encourage the participation of natural supports and team members. So in order to do that, what we're going to focus on is drawing natural supports from family members' networks of interpersonal and community relationships. In other words, this could include extended family, friends, neighbors, coworkers, members. It may also involve clubs that are located in the community or sports leagues that the family participates in. These will all really be individualized to that family. And we want to make sure that the folks that we're getting as natural supports are, again, going to have that committed relationship with the family. So that'll look different for every team. The wraparound plan is going to reflect those natural supports and the involvement that they play, different activities and the interventions that they decide are going to be used as strategies to support that youth and family. And so the idea behind this is that we want to draw on sources of natural support because they're sustainable to be there after the formal process and formal services have ended. That is collaboration. So collaboration as a principle means that team members, everyone is going to come together and work cooperatively and share responsibility for developing, implementing, monitoring, and evaluating a single wraparound plan. This means that the wraparound plan is going to reflect a blending of team members' perspectives. It's also going to blend mandates. So families that are multi-system involved, we're going to bring those partners from the system in as well and help to identify how, through a single plan, we can meet those mandates that they also have for their agencies and their systems. We're also going to be incorporating the resources and collaborating with those as well. So the plan will guide and coordinate each team member's work to meeting those team goals. And that's where that concept of collaboration comes in, and is really, really imperative within this process, because if you don't have a team that's collaborating, the family is not going to receive that coordinated plan of care, which is going to help them and be very effective in helping them to meet all of the demands that are on them at the time. The principle is that wraparound is community-based. Thinks that the team is implementing strategies that take place in the most inclusive, most responsive, most accessible, and least restrictive setting possible. So the idea is that we want to help youth and families, as we said earlier, live in their home and community, not learn how to live in a program. We want kids to be involved in wraparound, and they'll also tell you that prior to wraparound, they were isolated from their communities. They were isolated from community support, from activities. They may have been asked in the past to have to leave church because a child may have been acting out. They may not be invited to family functions because of the challenges that the young person living in their home has. They may also have been removed from daycare settings and other settings such as school, sports teams, etc. So the community-based aspect is really a focus on helping to reintegrate families back into those normalizing environments and helping them to be successful there. And this is a real important component, because what we were seeing, as you understood from the history, is that families previously were not being supported to do this. And so WRAP really wants to ensure that families have the resources to be able to remain in their homes and communities and to function there in an effective way. The next principle is culturally competent. Wraparound process really, as we talked about earlier, respects and builds on the views, the preferences, the beliefs, the culture, and the identity of the child and family, as well as those cultural aspects of their community. So in this respect, the team is going to work to strive to ensure that services and support, those strategies that they're coming up with and that are included in the wraparound plan, are built on the cultural competency of the family and demonstrate respect for family members, their beliefs, again, their values, their culture, their identity. The concept is individualized. Plans and services within those are going to be uniquely tailored to fit that unique family and that unique youth. As I talked about earlier, this is not a one-size-fits-all approach. It's not cookie cutter. One in wraparound is that the plan is going to be based in the family and youth perspectives about how things are for them, how things should be, and what needs to happen to achieve that vision. So yet again, we're looking for that best fit, what they need, how they need it, and when they need it. So that way they can have their needs met effectively by this process. Strength is another principle, and the wraparound process and the wraparound plan identify and build on strengths throughout the entire process. We're focused on enhancing capabilities, knowledge, skills, assets for the child and family. Also focused on doing that for the community, and so looking at the strengths by other team members. So we construct a wraparound plan. We'll do so in such a way that the strategies that are included in the plan will capitalize and enhance the strengths of the people who participate in carrying out the plan. Again, remind everybody that wraparound is intended to achieve outcomes. We're doing this not through a focus on eliminating deficits, but rather through increasing effort to utilize assets and to build an effective plan around those strengths. Then what we're going to talk about is unconditional care. And you may also know this as the concept of persistence. Increase, years, this was called persistence. You can use the two interchangeably, and you may see persistence written on some of the National Wraparound Initiative materials if you've had access to those. But additional care is the whatever it takes philosophy. The principle really emphasizes the team's commitment to achieving its goals regardless of what the child's behavior or placement setting is, regardless of family circumstances, and regardless of the availability of specific services within the community. This principle includes the idea that undesired behavior, events, and outcomes seen as a failure of the child or the family, and not a reason for the family or the youth to be ejected from wraparound. Instead, we take a different view in the wraparound process, and we look at some of these adverse events or outcomes as us, as a team, to go back and to revise the wraparound plan. It's going to be more successful and promote more positive outcomes associated with the goals the family has. So the idea here is really that families don't fail, plans fail. And when they're not working, that means that we're going to stop wraparound. That means that we're going to go back and we need to redesign this plan by looking at all of the other pieces that we've just talked about in terms of the principles. And we need to design a plan that's going to be more effective and is going to better meet the family needs. Not least, the final principle of wraparound that I want to talk about is that wraparound is outcome-based. This means that the team is going to tie the goals and the strategies of the wraparound plan to observable and measurable indicators of success. They're also, as I mentioned earlier, going to be monitoring progress in terms of, are we getting closer to meet the outcomes the family has identified? And if not, how can we revise this plan accordingly to do better at that? So in terms of outcomes, we really want to help families reach that family vision they're going to have identified for us. And, we will be checking in on that at every meeting to find out how much closer we're getting to achieving the family's vision, but we'll also be checking in on incremental progress that's been made. And are we have an effective plan to better serve this family and meet those unique needs that they have. That was a lot. We're going to go into one more piece that I want to talk about that is really founded in fee again. So I want to talk a little bit about the fact that, as we know, many models, again, have these values and principles. And many organizations have adopted those principles to suit their organizational structures. They've incorporated them into policies. But it's really important for us to understand how the principles that we just discussed are operationalized, why they're so important in the practice of wraparound. What we've done is we've identified 4 key elements in wraparound. Those 4 key elements are necessary components to ensuring not only a high-fidelity process is in place, but also that we're engaged in quality practice and implementation. So the 4 elements, as you can see the slide, are grounded in a strengths perspective, driven by needs, by an effective team process, and driven by families. I want to each of these, and we all have understanding understanding of what they entail. So the first is grounded in a strengths perspective. As I already talked about, Wraparound is a strengths-based process that was a basic commitment to strength seeking, strength generating, and strength building. The Wraparound plan is going to identify, build on, and enhance those capabilities, the knowledge, the skills, and assets of the family. But it's also going to ensure that it focuses on the role of all the team members, the strengths of the service environment, and the strengths that are located in the local community. We want to make sure that those are purposely and transparently used in our decision making and service delivery options. In this case, this is a pretty intense shift from how things have operated in the past. In Wraparound, the team takes time to recognize and validate the skills and the knowledge and these insights, strategies that everyone brings to the table and that everyone's used in their own lives to get through some of the challenging times that they've encountered in life. The plan of care is constructed in a way in which strategies are included in the plan and, again, will capitalize on and enhance the strengths of everyone who's participating in carrying out that plan. So in fact, we intentionally seek out strengths throughout the process, and we visit those strengths and build on those strengths at every child and family team meeting. In addition, we also want to make sure that this is something that the strengths perspective is grounded in mutual respect and appreciation for the value of each person that is on that team. And so that's another key piece of grounded in a strengths perspective. Again, because Wraparound is focused on achieving outcomes, we're focused on eliminating family deficits, but rather through efforts to increase and utilize their assets. These are all intentionally incorporated into the planning process and into each child and family team meeting. The key element is driven by underlying needs. And Wraparound is an organizing process that's designed to meet needs. The concept is somewhat different in Wraparound than in other approaches, because Wraparound is focused on, in terms of implementation, is the concept of the underlying need. So we focused on what those underlying needs are rather than what are superficial or basic needs. So, for example, rather than focusing on those surface level needs, the team, which again is inclusive of the youth and family, will work to develop better understanding and construct responses to address the underlying causes of behavior or situation. Many of us know needs go unmet often result in challenging and concerning behaviors, and those are ways that individuals communicate that they have an unmet need. Unfortunately, a lot of times in systems where challenging or risky behaviors arise, we tend to focus on managing the behavior rather than identifying and meeting the underlying need. This is pretty typical when you see in treatment plans that when challenges emerge, they're actually increasing professional services and increasing to have higher levels of care, and that they're not coming through with positive results. So in Wraparound, we think about those needs differently, and we focus on what a particular behavior means and what it's trying to communicate. This is how we arrive at that underlying need to begin helping teams create that desired change. An example that I want to give you to exemplify this is, for example. In the past, we used to look at running away as a need. And obviously, we do not want to see a youth having to run away. We'd like to address that, and we'd like to see a reduction in that behavior. But it's not a need. Instead, what we need to do is we need to take some other factors into consideration, and we need to look and understand better what are the thoughts and the feelings behind why that young person is running away. Perhaps it's because the youth doesn't feel safe at home, may not feel like they fit in, where they belong, they may not feel loved or appreciated, or they feel like their voice is being heard. So it goes on. And the underlying need, again, is going to be unique to each youth and family engaged in the process and engaged in that particular behavior. But it's important for us to really develop an understanding of the why behind that behavior, so that way we can better address it. So a wraparound is focused on meeting needs rather than containing problems. Key element is supported by an effective team process. So we've strategies. 2 heads are better than 1, and the more the merrier. And such things do apply directly to wraparound, and the idea that building effective team processes is crucial in the wraparound process. Wraparound is not something that can be done alone, and it is certainly not something that can be done by a single family, an individual, or an organization. The process is based on that a group of people working together around goals, objectives, and team norms are more likely to produce effective outcomes. In accordance with this, the team is obviously central to achieving those positive outcomes. And without a team, wraparound is not occurring. So this means that the folks that we need to get there to the table need to be composed of those individuals who have a strong commitment to the family's well-being. And they need to consist of individuals agreed upon by the family and committed to them. Again, as we talked about earlier, through those informal, formal, community support and service relationships. Another unique component of wraparound is that to be considered a team in wraparound, we have to have at least one natural or informal support at the table. So though the ultimate goal is to have more informal and natural representation on the team as we move through the process, we do ensure that when we get started, we have at least one informal support at table too. It's also important that we think about having consistency of team members. So we want to ensure that all team members are engaged, that their strengths are identified, and that they're incorporated into the planning process, that they feel they have a purpose on the team. One of the fastest ways that I've seen in my experience to lose a team is to invite people to a meeting and not provide them with an opportunity to participate. The round ensures that all team members are active participants. They leave each meeting feeling like they had a meaningful contribution to make to the process and to the plan for that family and youth that they're working with. And the final element that we want to talk about is determined by families. People know the saying, nothing without us or about us without us. And this is really the concept behind determined by families. We ensure that family determination, for example, the family's perspective, their preferences, and opinions are first understood, second, considered in decision-making, and third, able to influence team decision-making. So it's not as simple as choosing activities and, oh, well, we did that because the family said so. That's what we wanted. Wraparound, all team members are expected to have enough depth of understanding so they not only know what the family wants, why they want it, and how those choices relate to the unique family's strengths, cultures, and needs. Again, this is going to include both youth and caregivers, and the family in the wraparound process does have the authority to determine the decisions, the strategies, and the resources that they feel will best meet the needs of their family. Again, this goes back to that central theme that I talked about earlier, that families are supported to live a life in a community rather than a program. Times in the field, we find that human service workers are really great at their jobs, and they want to provide help by fixing things for youth and families. So you'll see human service workers that go into family homes, they assess the situation, they come up with some ideas, some solutions, and they try and pick families up and provide all the answers and all the support. We like to call this a turbo case manager. They're the everything to the family. What happens, unfortunately, is when we try to do this as human service workers to try and save families and ensure that they move through our program or our services, we have with a family that does not have the skills to succeed and sustain over the long term. Because what happens happens when the program ends? The families fall back into the circle. They re-enter the system because they were supported to live in a program rather than a community. So we want to make sure that we're diligent, that highlight the importance of determined by families, and want to make sure that we're supporting families in their communities. It's also critical when we talk more about access and voice and ownership. So families need to have access to be able to incorporate the people and the processes in which decisions are made. They need to be involved in that decision making, have influence and choice and authority over the services and supports that are identified. Again, more of what's working and less of what they perceive as not working. Families also need to have voice. They need to be heard. They need to feel listened to. They need to feel like the team recognizes that they're crucial stakeholders in this process and that they are critical component partners in setting the team agenda and making decisions. Finally, families need to have ownership of the planning process. Families have access and they have voice. They can make a commitment to the plans because they've been involved in creating those plans. They've been involved in creating and identifying the strategies that are going to be implemented to meet their needs, and that they can be then committed to following through on the plans as they're implemented. All important aspects of determined by family. All right. So the next screen that we have is our theory of change. And while I know that this may be rather intimidating from the slide, it is actually much more simplistic than it appears. The theory of change for wraparound begins with the assumption that teams carry their work in a manner that's consistent with the principles of wraparound, and that the interactions that reflect these principles are going to be evident throughout various activities. So as you can see, they're going to be grouped into phases that make up the wraparound process. And I know we haven't gone too in-depth about that, but there are 4 phases, several activities associated with wraparound, as are the 10 principles. These principles and practice activities come together and are supported by that core implementation component that we see on the left-hand side of the screen of staff training and coaching, evaluation and quality assurance, build those necessary staff skills in order to achieve the 4 key elements and the essential process components. This results in a high-quality, high-fidelity process carried by a well-functioning and hopefully cohesive team. So in this aspect, we find that members are committed to meeting the needs that the team's identified. They're optimistic about meeting those needs. They're motivated to carry out their roles in implementing strategies and to achieve outcomes. And they're also committed to helping the family move closer to their needs met and vision achieved. When all of this occurs, what we find is that we can expect some intermediate outcomes of engagement in wraparound. And these include participation in wraparound. We said it builds family assets. Experience with those proactive planning processes helps to increase coping skills, confidence in problem solving, helps to confirm the strengths and assets and capabilities of the family, and results in that positive identity. As we know, people who feel that they're playing an active role in their own lives and are empowered to make meaningful decisions have experiences that contribute to their self-efficacy. Second intermediate outcome that we see is that promote family and youth empowerment and engagement in choosing services and supports increases the extent to which those services and supports fit the family. We talked about this previously as we've talked about best fit. So a cohesive team whose decisions are driven by the family, they choose and tailor those formal services and natural supports and informal services to create a package, not the traditional package we think of where services are all lumped together, but an individualized, customized package that services and supports will complement each other and work better in conjunction with one another to meet family needs. If this happens, what we see is that families are going to have improved engagement. They're going to be more engaged in the process. process, more committed to the process, and will be invested and retained in those services and supports longer. Finally, we have the long-term outcomes that we can expect from wraparound. If they're successfully engaged, committed, and retained in the process, should experience positive child and family outcomes. And these include several different aspects, such as teams being achieved, being met, increased assets, increase in family independence and efficacy. Also, another key, increased social support and involvement in their community, improved outcomes in mental health, improved outcomes in education and safety and vocation. So these are all some of the long-term outcomes that we can expect from wraparound when implemented in a high-fidelity, high-quality manner. One more I want to say about this diagram before we move on is that I mentioned that although this diagram implies from the arrows that this is a left to right and unidirectional flow from that process component that we see outcomes, a more accurate description would really show a more dynamic and multi-directional flow. Again, since wraparound is a process of creating, implementing, evaluating, and adjusting versions of the plan, we're going to see that more multi-dimensional flow when it's in a more natural setting. Just wanted to clarify that for everyone. Right. So workforce development is a core component in wraparound implementation. And in order to achieve high-quality wraparound practice, the Institute focuses its training and coaching on a few key areas. The first is knowledge. We want to ensure that there's knowledge of history, the theory behind wraparound, the philosophy of wraparound, and that there's also rationale so that people understand why wraparound is a better route to reaching positive outcomes with families than other approaches. We want folks to understand the initial process components of wraparound, the principles, the key elements, all of those aspects that we've mentioned and how those fit in. We want them to have the opportunity to practice the elements. And so we want to ensure that there's that demonstration component. We also want who are participating in training and coaching to have opportunities for behavior rehearsal so that they can practice the skills that they're learning. And again, provide them with the feedback on that practice so that they can fine-tune those skills and that they can incorporate new skills into their repertoire. All right. As you can see here, the model that we use really focuses on identified skills and competencies that are necessary for wraparound practitioners to be able to implement wraparound in a high-fidelity, high-quality manner. So although the key elements and essential process components and principles provide that framework for training and coaching, the Institute also highlights the importance of the theory of change, as we've already talked about and seen in a previous slide, that describes exactly how that skillful wraparound practice will lead to desired outcomes. In this respect, as you can see from the slide, early training and coaching provided by the Institute is going to focus on building those apprentice-level skills. For example, as we mentioned, we're going to focus on building that orientation to wraparound, the new knowledge, helping practitioners to use the perfunctory and routine use of skills, refining, etc. So we're going to move up through that process. And we will ensure that practitioners are trained and coached not only on the how to accomplish each of the activities of wraparound, but also to understand why this way of facilitating the process is going to lead to more positive outcomes. Organize training and coaching in a way that ensures that wraparound practitioners don't become too overwhelmed by learning the process, because for many folks it can be a tremendous shift in the way that they do business with youth and families. We want to ensure that they can focus on a specific skill set and in that in their initial months of practice, and then incorporate further skills as they become more comfortable in the process and as they become more comfortable with the skill set of the process, so that they can move through and begin to demonstrate mastery of wraparound. encourages practitioners as they gain experience to move to more expert levels of practice, and finally, to reach the innovation stage, where it's hoped that they'll be able to incorporate some more experimentation and innovation into the effective, high-quality wraparound work that they're doing. And this involves several stages of development, and the Institute supports practitioners, coaches, etc., through each of these stages so that they have support and they have guidance throughout this entire process. Talked a little bit about the central idea behind the Institute's model is that training combined with coaching is going to create conditions in which quality implementation occurs. And these are important components for achieving, again, this positive outcome with youth and families. We also want to do is mention that this is coupled with the focus on, again, operationalizing values, as we've talked about with Wraparound, and so in a practice setting. So again, developing specific skills and competencies around that practice model that are imperative for creating a workforce engaged in, again, high-quality, high-fidelity wraparound. Another piece that I just want to mention that kind of goes along with this slide is that a comprehensive review that was done in 2005 regarding implementation research that was conducted by Fixon, the essential and indispensable core components of of implementation and effective implementation were staff training, coaching, and evaluation, combined with an integrated, coherent, and theoretical framework that underlies them. And I think, as we've just talked about in the last few slides, as well as on this slide, I think that the Institute has really intentionally designed its training and coaching model to do just that, to ensure that all of those components are present within its training and coaching of practitioners in the field. So, as many of us know, adults do learn differently from children. And research on adult learning theory has indicated that all of these components, telling, showing, practicing, and feedback, when used together, will result in a greater transfer and higher retention of knowledge, as well as a greater understanding of the application that that information has or that content has to real-world settings. So in this respect, the Institute utilizes all four aspects to deliver its training modules. So for example, training may be delivered through a lecture, discussion is being used to disseminate knowledge and build the content for understanding. Training be focused on showing practitioners within that training setting how to utilize and apply skills throughout the phases and activities of wraparound. Our training also provides practitioners with the realistic training content that they need in order for them to have an opportunity with training environments to practice the skills that they're learning in a staged skill development setting. So that piece is really crucial because, we find that when adult learners get the opportunity to really, really practice and apply what they've learned, they really do have a much easier time applying that into their day-to-day operations, not only with wraparound, but with other things. So this is a really crucial component, and that's really going to lead them to that skill refinement over time. And finally, practitioners also receive that structured and helpful feedback and follow-up support on doing the results of those implementation efforts. That's done during training. It can also be done following training, during coaching sessions. And that way, again, using that feedback, they have the opportunity to adjust their practice to better align with the high-quality, high-fidelity implementation efforts that are going on. All right. So there's 6 components that we've identified that are crucial to ensuring effective coaching is occurring. And as you see on the slide, each of these components is interconnected. And these are used collectively in the Institute's model for coaching. And we find that this is the most effective approach. In these components, what we want to do is that we want to ensure that coaches are supported by our national coaches, and that the local coaches that are identified have the opportunity to support practitioners as well as supervisors with the wraparound process. So that means we're working from engagement to transition. So the first component that we want to talk about is the accessibility. And in many situations, we find that there may be a trainer that comes in and they train on the process and they, talk about all the different components. They have some role of doing coaching as time goes on, but they're not really accessible. So the Institute wanted to ensure that the coaching that it provided is both readily available to the states and practitioners, that coaches, that it's intended enough to build a capacity within the state. So as I mentioned earlier, we want to create those local coaches as experts. We want to ensure that the local coaches have access to the Institute trainers, and that they can, not only see them during those monthly site visits that they'll have, but on a needed basis. So that means that they have contact with the national trainers and coach via email, phone calls, text messages, etc. That way they're getting that ongoing support and accessibility to the coaching. We want to ensure that coaching is based on a practice model. And we've discussed a little bit more in depth already. As we've talked about, we're focused on, again, the principles, those key elements, phases, and essential process components. But we also want to make sure that we're focused our coaching on that theory of change, and so that we can inform practice, so that we can achieve the best outcomes for families and youth that we're working with. It needs to be supportive. We ensure that all local coaches feel supported throughout the training and coaching process, throughout the implementation of wraparound. We ensure, again, that they not only have available support on an ongoing basis, but our coaches build on each individual's strengths. They coach skills in a positive, helpful, and meaningful manner, so that way they can be incorporated into their practice better. It also ensures that our coaching is flexible, so that we're providing coaching to accommodate the needs that we're working with. You want to make sure that we're working around time frames that work for those folks. We also want to make sure that we're adapting coaching activities to better support local coaches in implementation efforts on the ground level. And we want to make sure that we're flexible in supporting our states and the system structure that we have, and working, within what the realities are on the ground to implement wraparound at the highest quality and fidelity level. We also make sure, as we've mentioned, that our coaching is reflective. So again, we want to focus on that feedback. Feedback is going to be intentionally thought and provided to individuals at all system levels. We want to ensure that we're effectively transferring wraparound skills. We also want to ensure that local coaches and supervisors and staff all have the opportunity to receive feedback. And some of those specifics we've already mentioned, but we'll go into that a little bit later as well in the presentation. And finally, coaching needs to be individualized. So as we discussed earlier in the principles of wraparound, this means that the Institute recognizes that the unique skills and strengths of each local coach, as well as specific areas of need to be fine-tuned. And we need to fine-tune our coaching to build the skills where they're struggling most and create a customized coaching plan for each individual coach that we're working with. This goes for the local coaches that we're supporting to do this as well with the staff that they're coaching through the wraparound implementation process. The aspect of individualized is that we want to make sure that each state system receives a tailored and customized coaching approach to meet the needs of the state, ensure that wraparound implementation occurs, again, within that framework and the context of each state's policies and system of care.
is somebody speaking right now?
Oh, sorry, my phone I accidentally hit it. This is Kim again. So I'm sorry about that. It broke my cheek, I believe. So we'll go on. Is everybody still? Okay. All right. So the next piece that we want to go into is the whippets. And these are the wraparound practice improvement tools that we use. We're going to go through these a little bit more in detail. I want to just quickly go over the tools that we have. So whippet stands for Wraparound Practice Improvement Tools. And we have 4 that we use on a regular basis when we're engaged in coaching and training in a state. The first is the COMET, and that stands for Coaching Observation Measure for Effective Teams. The next is our supportive transfer of essential practice skills, or the STEPS wheel. I also have the Coaching Response to Enhance Skill Set Transfer tool, or the CREST tool, and the Super Assessment System, or SAS tool. So as we are looking at the COMET, it's going to be very hard for you to understand without actually having a tool in front of you. But the basics of the COMET is that it's designed to be a tool that's used in supervision, in team observations, plan of care reviews. COMET walks across all 4 phases of wraparound and identifies essential process components that must happen within each of the key elements that we talked about earlier. Within each of these elements, there's also going to be a list of skills that need to be demonstrated and scored. And these are, again, going to be used together and in conjunction with one another. So you're going to see how this fits in a little bit as we go on. The next tool that we talked about is the STEPS wheel. And the STEPS wheel, as you can see, it will assist coaches and supervisors with moving the conversation from talking about families to talking about how care coordinators are implementing the process with families. So the wheel is designed to structure the dialogue with staff. We're going to begin by talking, as you see in step 1, about initial conditions. So we want to explore not the initial conditions of a specific referral, but we want to explore how the care coordinator has interpreted those initial conditions, and then move on to looking at the strengths. So again, moving to team and, asking about the team structure and how it's been, designed in order to best fit the last 2 steps. As we go around the wheel, really going to be looking for how that individual, the practitioner, is implementing these components of the process into their meetings and into the work that they're doing with all families and youth that they're serving. The piece that I do want to mention is here it does talk in step 5 about mission. And a piece to think about with mission is that we frequently think about the vision or the mission of the team. And this is really more about what the practitioner's mission is. And I think it's important that we look at that piece because a lot of times when we're working with youth and families, as we mentioned earlier, we may have our own particular mission in mind. So we want to address that. And that needs to be done in a coaching and supervision atmosphere so that can be reconciled and we can be more in line with the team mission and the family vision. So, forward, we also have the CREST tool. And the CREST tool is, again, a proactive coaching tool. And this is going to be used in supervision to give feedback to staff on what you want them to do, why you want them to do it, and how you want it done. And again, this information is going to be connected back to those action steps in the STEPS wheel. So looking at the STEPS wheel, perhaps it's initial conditions that we want to ensure are addressed. So we'll have to talk about, through the CREST, as you can see on this slide, to introduce that task. We're going to talk about the steps involved. Why do we want this done in a particular way? We're going to route those steps back to one of the 4 key elements. We're also going to relate the steps back to that employee gain. Why is this something that would be beneficial to the employee, as well as the youth and family and wraparound team? We then demonstrate the task. So we want to make that we've not only discussed it, but that we've shown the employee how to do something, and we've asked them to show us how they're going to do that. And perhaps we may point out how other individuals are doing it this way, what their outcomes have been. And to establish a time frame. So I want to talk about when this is to be used, how quickly this needs to be implemented, and when we're going to follow up with each individual. The next piece is the Supervisory Assessment System, or the SAS tool. And this tool is designed to be used as a quality review tool. So this assesses the skills of the supervisors and how they're translating those wraparound skills and values back to the staff. It focuses on several areas. I know that you can only see one here, but it focuses on not only communication, but coaching and analysis. And once assessed, supervisors and local coaches, can then be coached in areas of needed skill building in order to more effectively transfer the knowledge and skills to their staff. All right. And as we talked about earlier, we're going to go a little bit deeper into just some of the training modules that we do and the specific arenas that we do engage in coaching in. As you can see from the slide, this is a pretty broad overview. Again, I'm going to be working directly with the leadership team in Virginia to determine exactly how this structure will be implemented in your state, as well as how often each training is going to occur and who will be identified to participate in each. In general, the Introduction to Wraparound training is a 3-day training. It focuses on the critical components of the process, the practice steps of the process. It helps for participants learn how to create a family story. It reinforces the strengths perspective by teaching them how to identify functional strengths, teaches them to develop those vision and missions that we talked about, identifying underlying needs, etc. And that training is really focused on practitioners, supervisors, directors, and other community partners that may be participating in child and family teams. The next engagement, and again, that is going to be open to the same population, and really going to cover those barriers to engagement, develop skills to better engage youth, family, and team members, and utilize those research-based strategies to increase positive outcomes for youth and families. We have intermediate wraparound, and this is really used to address the common implementation challenges that facilitators are finding. So these topics tend to be adjusted based on what's going on with individuals, what's going on within the organization, and what the state need is. And then finally, we have advanced wraparound. And the advanced wraparound is really going to be focused on supervisors and managers, and they're going to teach to them the essential elements of quality wraparound implementation, their role is as a supervisor in wraparound, how they can manage for quality throughout the phases. So we're giving them some supportive tools so that they can better, more effectively transfer that knowledge and those skills to the workforce. And finally, as you can see, coaching through the Institute takes place through all phases of wraparound, as well as in several different venues. So coaching is going to take place during face-to-face meetings with families. As you see here, home visits. We may be observing team meetings, phone calls with families and team members, during supervision with staff, and again, prior to those child and family meetings and after the child and family team meetings, so that we can provide that feedback. And again, our structure is that during each of these contacts, the local coaches been identified will be the ones directly providing the coaching to the frontline staff and supervisors in order to ensure, again, that wraparound implementation is occurring at a high fidelity and quality manner. So the Institute staff, such as myself, will provide coaches with the necessary support and guidance and feedback for them to be able to, in turn, coach others on the process. The expectation is that expertise is going to be left within the state, and that those local coaches will be empowered to facilitate that training and that knowledge building and coaching efforts on an ongoing basis. All right, and that is actually all that we have on the process. What I'd like to do is provide you with our contact information right now, as you can see. And my name was Kim Biello, and I can be reached at that address, and Marlene can be reached at the email address below that. However, I know that we don't have Mendy's information here. So, Mendy, do you want to perhaps provide your information so that if people need to ask you specific questions, they can contact you?
Okay. Probably the best way to reach me is going to be through email, and my email address is Mendy, M-E-N-D-Y, .meeks, M-E-E-S, at dmass.virginia, spelled out, .gov. And then the other thing I will leave is my phone number, though sometimes it is difficult to get me while I'm sitting at my desk, but the number is 804-225-4285. I have questions regarding the wraparound for our state and our movement. I'd be happy to answer those. Some answers I will not have yet, as we are still in our beginning stages rolling this out, but I do plan on providing links on our website, on our DMAS website, under the Behavioral Health Services portion, and making everybody stays informed on next steps and training.
So we can hear everyone talking now, just as an FYI, because you've been unmuted. So for those of you who can hear me right now, you should probably mute your phone because we can hear you talking. We wanted to open a line so if anyone had any questions.
Can you tell how we can print the presentation?
Hear you. I know someone just talked. There's a lot of background noise.
Can you tell how we can print the presentation?
We can. We can. Mendy, do you have a way of posting this presentation to get it out to people? Okay.
Yeah, I'm sorry, and I know that one of the things that we had already discussed was that we are going to send Mendy the link, and that way, the version of the presentation, and that way she would be able to send that out to folks who are interested in sharing this with other individuals in their agency.
Great. Does anyone have any additional questions?
Any questions, you guys? Nope. Thank you so much. All right.
Well, for joining us, and we hope that you were able to get some information out of this and that this will be helpful in better understanding the role that the institutes play in Virginia and really moving wraparound implementation forward for your state.
Thank you.
Thank you.
Thank you.
Thank you.